I bleed sometimes, a little when brushing or flossing, but doesn't everyone? That is a common statement many of my patients make. Somehow, over the years, the idea that it is okay to bleed from your gums has developed. Nothing could be further from the truth. Hi, I'm Dr. Kaz Zymantas here at Premier Dental Center, just 2 blocks east of Naperville North High School on Ogden Avenue in beautiful Naperville, Illinois. In this video, I will discuss what causes bleeding gums and what can be done to get rid of the problem. So what is so bad about having a little bleeding from the gums when eating or brushing? People that have this problem have a serious infection. This infection is known as periodontal disease, sometimes also known as pyorrhea. Let's step back a little here and discuss what causes periodontal disease. There are over 700 different types of bacteria living in your mouth. Only about 10 of the bacteria cause dental problems. There are usually no problems in the mouth as long as the bacteria can freely float around in your mouth. Gum disease is caused by plaque. Plaque is a sticky film that develops on the teeth. Bacteria stick to this film and begin to have families of bacteria. Your body does not like the idea of plaque growing on your teeth. Your body begins to think that your teeth are foreign objects. Imagine when you get a sliver in your finger. The body develops inflammation around the sliver and gets rid of it. The area is very red and swollen. The same thing is happening in your gums. The inside space at the gums is actually ulcerated. Your gums bleed when you disturb the ulcer. The problem begins to get worse when the gums unzip from the teeth and the bone and the deep pocket forms in between the teeth and the gums. Bacteria go deeper and deeper into the tissues and cause major infection. Because of the great blood supply to the mouth, the bacterial infection gets into your bloodstream. Factors from this infection go through your blood to the liver, and your liver then makes other factors called C-reactive proteins. C-reactive proteins are other factors that go throughout your body. Recent research is finding out how destructive these C-reactive proteins really are. Pancreatic cancer, early onset dementia, Alzheimer's disease, diabetes, stroke, heart attack, and the list goes on. And the whole problem starts by bacteria that stick to your teeth. The solution to the control of the gum disease is to be able to get access to the area where the bacteria grow. Some patients have let the problem go for too long, and the space in between the gums and the teeth gets deeper. We call this space a pocket. Healthy pockets are 3 millimeters or less with no bleeding. When the gums open up more, your brush cannot clean deeper. More bone is lost until the teeth fall out. Periodontal disease is the #1 cause of tooth loss in patients 30 years and older. All you need to do to prevent gum disease is to learn how to disturb the bacteria on the roots of your teeth. Some patients cannot clean all the surfaces of their teeth well and need to come into the dental office more often to clean off the plaque. Some patients need advanced treatment or surgery to save their teeth. I hope this video has been informative for you. Remember, there is nothing as preventable in all of medicine as dentistry. We currently have all the necessary technology to prevent just about all dental problems. We have a slogan here at Premier Dental Center. Let's take care of the small problems before they become big. We have more informative videos at the website listed below, or just call the number below. Thank you for watching. Bye-bye. Hi, I am Dr. Kaz Zymantas here at Premier Dental Center, just 2 blocks east of Naperville North High School on Ogden Avenue in beautiful Naperville, Illinois. Some of my patients with dental problems ask me why they should hold on to their teeth instead of just getting a new set of dentures. Let's first talk about what dentures are. Dentures are dental replacements that have a base made of plastic and ceramic or plastic teeth that are inserted into the plastic. When a person has a full denture, there are usually no teeth left in the mouth. Patients that wear dentures can only bite with about 15 to 5% of the force of someone with all of their teeth. That means they've lost 95% of their efficiency. Some patients that have an exaggerated gag reflex cannot wear dentures because the upper denture usually covers the entire palate, which makes many people gag. Food does not taste as good because many of the taste buds are located on the palate and are covered up by the plastic. Patients usually have to severely modify their diet because the dentures wobble around on the gum tissue if harder food is bitten. No more steak or good, tasty, crispy French bread for you. Small seeds like sesame or poppy seeds can get stuck under the dentures and cause significant irritation and often a socially embarrassing situation. Many patients need dentures because they lost their teeth due to gum disease or periodontitis. These patients may have an extremely difficult time to hold on to the dentures in their mouths because of the extensive bone loss due to the periodontitis. The more bone a patient has left in the jaw usually makes it a little easier for the dentures to stay stable. A significant problem for patients with full dentures is that the bone that supports the denture is slowly lost over time until there is sometimes not enough bone left to hold the denture in the mouth. Probably everyone has seen older people with very poor fitting dentures or just people with no teeth. The facial appearance is quite unattractive because the face looks like it has collapsed. Some people try to glue the dentures down to the gums with dental adhesives like Polygrip. This glue has to be applied several times a day because the glue leaks out from under the denture and the patient ends up swallowing the glue. Can you imagine what that glue does to the insides from swallowing this goop on a daily basis? Ugh. Certainly not very appealing. Patients that have severe periodontitis or have worn dentures for a long time may not even be able to have dental implants without needing bone grafting to rebuild the bone. The process of bone grafting can be complex, painful, and very costly. We already spoke of the potential embarrassing situation of seeds stuck under the dentures, but dentures also have to be taken out at night and placed in a container of water. This alone can make some people cringe at the thought of taking out their teeth every night in front of their spouse. For some people, dentures may be the only alternative and may be useful for some. The moral of the story is this: you should try to hold on to your existing teeth if your dentist can make the situation stable. Full dentures are a treatment of last resort. Regular dental visits and good oral hygiene will help you keep your teeth for a lifetime. You do not need to be the person who believes that a denture will take care of their problems and then find out too late that they cannot wear dentures. There are some very tragic cases with some very upset people. There is no other branch of medicine that is as preventive as dentistry. Just about all dental problems can be prevented with proper care and knowledge. I hope this video has been of value to you. We have other informative videos at the site below, or just give us a call at the number below. We look forward to hearing from you. Goodbye.